Good afternoon. It is Friday, and that means it is time for our lunch and learn. Now, today we're going to be talking about eye health and gut health and how they are connected. Now, I'm going to show you this picture. This is an iris map picture. We use this in the clinic all the time. And when you come in, especially on your first visit, I'm going to do an iridology evaluation. I'm going to take pictures of your eyes with my beautiful big Canon 10 megapixel camera, and I'm going to put it on the screen. I'm going to show you how all of these sectors are showing up in your eyeball. But one thing I want to tell you about right now, so this is the left eye because it has an L in it. This is the right eye because it has an R in it. I can know because I've taken the picture and that kind of thing. However, what we're going to be looking at specifically, you've got your pupil here, and then that circle right around the pupil, that is your nutritive zone. And so when we look at your eye, we look at that nutritive zone because that nutritive zone is going to tell us if your stomach is working the way it needs to. And so we're going to ask you a lot of questions, and I'm going to already know by looking in your eye what's going on. So I love iridology because it gives me a really good snapshot into what's going on with you in your DNA. Now, that doesn't mean that it's diagnostic at all. It is not. However, if there are, let's just say there's just a lot of diabetes in your family, it's going to show up in your eye. That doesn't mean you're going to be diabetic. It just means that it's going to show up there. So eye doctors are finding out that there is a big connection between someone's gut, their microbiome, and what goes on in their eye. And these reports that I'm going to be sharing with you today show that if you take care of your gut health, you can actually take care of your eye health, which is just like amazing because people think that they go to the ophthalmologist because there's something wrong with their eye, and you do. However, the really good doctors know that everything is coordinated by what's going on in the gut. And so if your gut is not right, if you're not getting what you need there, then you're going to have some issues. So there is a Dr. Kondrot, and he gets to know his patients with a lot of small talk when they come in for an examination. Now, he is both an ophthalmologist and a homeopathic doctor. And he says when he's doing the small talk and he's finding out, not with probing questions and that kind of thing, but just like, what did you do on your summer vacation? You know how you did when you went back to school. People start to reveal things about their lifestyle, their stress levels, and all that kind of thing. And so he's saying that your stress levels can be a key to you getting healthy. His get to know you questions continue through daily habits, work, and even digestion. His patients think that he's just being chitty chatty, but he knows that their lifestyle decisions factor into their gut, and their gut factors into their eye symptoms. And so he is trying to figure out what's going on with that, which I think is really good. This is a quote. He says, "I know that the more I know about you, the better I can treat your eyes. Most eye doctors just focus on the eye, what's going on in the eye, what eye drop, what surgical procedure, or what injection they can do. But you need to look outside the realm of the eye. You have to be a detective when you look at eye diseases. What goes on in the gut is reflected in the eye." So getting questioned about your gut health might not be the norm in the eye clinics across the United States, but it is becoming more and more frequent because people are looking at the literature and people are looking at the research papers, and they're finding out that your gut health has a lot to do with your eye health. And an August review published in Curious, C-U-R-E-U-S, I probably didn't say that right, noted that a number of chronic eye diseases are associated with a disrupted gut microbiome. In short, eye patients often have an imbalance or dysbiosis of gut bacteria. It is essential to explore the bidirectional relationship between ocular health and the gut microbiota dynamics to provide a comprehensive framework for managing chronic diseases and associated comorbidities. Leveraging microbiome knowledge will promote greater efficacy in managing ocular diseases and thus benefits the patient's quality of life. This is what the authors of the review wrote. So let's talk a little bit about dysbiosis. Dysbiosis is what is the diversity of your microbiome. Even deeper than that, you've got your nucleus of your cell, you've got your intracellular matrix, and then you've got your extracellular matrix. So the nucleus is the circle. Think of a fried egg. Think of two fried eggs, okay? The yolk of the egg is the nucleus of the cell. The white part of the egg would be your intracellular matrix, and then the space between the eggs would be your extracellular matrix. And so one of the things that we look at and we evaluate for when you come in for a holistic healthcare appointment is what is the level of the dysregulation of the dysbiosis. That's a lot of words there that you probably haven't heard before. But what that means is where in the tissues are the pathogens trapped, what is going on in the gut, and what kind of microbes do we need to replant in the gut because you've had antibiotics and you've had stress and you drink chlorinated water and you bathe in chlorinated water and you brush with fluoride toothpaste and there's fluoride in your water. All these things affect your gut microbiome. And so when you lose that diversity, then you lose a lot of your immune system. And when you lose that, then your body just doesn't respond the way it is supposed to. So a growing number of lifestyle factors such as diet, stress, antibiotics, drugs, and alcohol have been associated with dysbiosis and compromised intestinal barrier function, sometimes described as leaky gut. So let's just talk about that. There are some medical doctors that say leaky gut does not exist. However, we know that it does exist, and we know that it exists because there are diseases like celiac disease, Crohn's disease, all those kind of things. And yes, I know Crohn's disease is in the large intestine. However, if your mucous membrane from your mouth to your bottom is disrupted by anything, then everything is going to be affected. And so what leaky gut syndrome means is in your small intestine lining and also in your large intestine lining, your cells are very, very tight and they form a barrier. When you've got leaky gut syndrome, it's like your tight junctions open up, and that allows for undigested food. It allows for undigested proteins and other pathogens to move through that small intestine barrier into the bloodstream. The body recognizes that as a invader. It recognizes that as a immune response, and so it is going to send all the soldiers there to figure that out and figure out what's going there. So we know that eating a lot of gluten, certainly in the United States, eating a lot of gluten is going to cause those junctions to open up, and we don't want that. We don't want undigested food passing through the intestinal wall into the bloodstream because that sets up an allergic response, and we don't want that. That's not good. And there's a lot of things that we can do to help you. Number one, you got to change your eating, right? Nobody wants to do that. You also have to do some GI repair so that we go back and repair and lay down that mucous membrane again because it's been damaged. So we want to know that our chlorine and our stress and all that kind of fast foods, right? And all of us eat fast foods from time to time, but that messes up our gut. So leaky gut is a bit of a controversial notion, as our intestinal mucosa is designed to be permeable and there's no standard test to gauge whether loose junctions in the intestinal epithelium are allowing harmful toxins into the bloodstream. Leaky gut can be a moving target for lab tests as the intestinal lining renews itself in cell turnover every 2 to 4 weeks. Now, if that was really all there was to know about that, then people that have intestinal problems would not have intestinal problems in 2 to 4 weeks. But we know people, and you may know people, and you may be one of these people that have had intestinal issues for years. So there's just a lot more to it than the mucosa turning over. Sometimes there's pathogens in the gut that will not allow that mucous membrane to regenerate itself. Researchers have also connected intestinal permeability to dysbiosis, which is linked to compromised health in other locations within the body. This was that same review I noted a while ago. One location is the ocular mucosa, the barrier that protects the eye against allergic, inflammatory, and infectious invasion. Now, this interface is known as the gut-eye axis. And honestly, before I read this report, I didn't even know that was a thing. Okay, so this is brand new, August review, so just a couple of months ago. So we're just on the cutting edge here. This is a quote from the review. Loss of intestinal barrier integrity and increased vascular permeability allows bacterial translocation and their products into the bloodstream, leading to the passage across the blood-retinal barrier, according to the review. Bacteria products are lipopolysaccharides, commonly referred to as endotoxins, and they cause chronic inflammation. What is chronic inflammation? Every disease is a result of inflammation. That is chronic. That means it's long-term. It's unresolved. So think about if you cut yourself. I got a paper cut the other day. If you cut yourself, then you're going to bleed. It's going to get swollen. You're going to get a scab, right? You could even run fever in that area. All of those are immune responses, and yay that we have those. That's an acute response. It's going to be resolved in a couple of days, maybe a week, depending on how deep it is. It could be a little bit longer than that, but the issue is that it resolves. Chronic inflammation never resolves. And so one thing that you can do is you can look at your blood work, and you can look at a value called CRP. All right. And that stands for, I'm not quite sure what it stands for, but it is a inflammation value there. And so they want that to be below 0.1. I've seen it as high as 12, and that is a chronic inflammatory response. I used to know what that meant, but I'm going to say the wrong word, and I'm going to get corrected again. So just look on your blood work. It's CRP. All right. So we don't want to have that chronic inflammation. Researchers do not know the exact mechanics involved in diseases linked through the gut-eye axis, though the review noted several theories that involve the interaction between the microbes and the immune cells, which could cause some people to have more intestinal permeability than others. I personally think that there is a genetic predisposition, but I also think it's what you put in your mouth. So if you're always eating bread, if you're always eating pasta, if you're always eating cakes and pies and anything that's made out of flour, all right, here in the United States, all of our grains that are farmed in the industrial food complexes are sprayed twice with glyphosate. That glyphosate is a pesticide. It gets on the grain. When we eat it, it gets in our gut, and it is a heavy metal, and it causes heavy metal poisoning. What it also does is it is a food source for parasites. Don't ask me how that works, because I don't really know. But we just find when there's heavy metal toxicity, there's parasites there too. So you don't want to be eating that. If you're eating organic pasta, organic bread, then you're not going to have as much gluten sensitivity. So check that out if you can. We go to a little Italian restaurant down in Rockport when we're down there, and they import all of their flour, all of their pasta, all of their things from Sicily. So they are not products of the United States, so they are not contaminated. So you want to look for that. Activated immune cells, endotoxins, and pathogenic bacteria that escape the intestines are capable of reaching the eye, where a number of inflammatory responses can take place and damage the eyes, according to the review. Now, this is just a fun fact. This is not in this report, but everybody has E. coli in their gut. They just do. Everybody does. And so that could be one of the bacteria that translocates because of intestinal permeability. So if that's something that you have, that's something that you need to get resolved. What are some symptoms? Gas and bloating, constipation, IBS, all kinds of issues that are not quote unquote normal. A lot of people think that, going to the bathroom once a week is normal. That's not normal, people. And so when that happens, you've got gut dysbiosis. And when you've got gut dysbiosis, you've got all of these opportunities for things to not go right in your body. So the means of the physiology of a number of eye diseases is not entirely confined to the eyes, a fact that more and more ophthalmologists and patients need to take into consideration. So here are some eye diseases linked to gut dysfunction, all right? Dry eye, glaucoma, autoimmune uveitis, and retinal diseases are specific eye diseases that have a link to the gut microbiota according to the review. Dry eye is a consideration in which the eyes do not make enough tears or they dry out too fast. Dry eye has different causes and forms, but the studies have noticed that specific increases and decreases in the number of certain bacteria coincides with the different types of dry eye disease. So this is important. What does that mean for me as a human? That means if I've got dry eye, I need to repopulate my gut with beneficial gut bacteria so that I can alleviate that dysfunction so that my eye is not dry, all right? Glaucoma. Several studies have confirmed the link between intestinal dysbiosis and glaucoma. This is a progressive optic neuropathy or damage to the optic nerve. Now, one of the things, glaucoma does not have a symptom. You don't know that you have it. And this is why older people need to go and have their eyes examined regularly. Honestly, I can't say that I go once a year. Honestly, I can't say that. However, I do go once every 2 to 3 years for sure. And part of that is because glaucoma is a disease that does not have a symptom. You know, if you wear glasses, if you wear contacts, when your vision gets a little blurry or whatever, you know that you've got an issue, so you make yourself an appointment and go there. If you don't have those symptomatic dysfunctions, you may still have glaucoma and you're not taking care of it because you're not getting an examination. And so what happens is there's too much pressure build up in the eye, and that pressure will cramp up the optic nerve and you will go blind, and there is no resolution for that. So everybody, please take care of your eyes and make sure that you're not having that. There are some things that we can do holistically. However, we always recommend that our people who have glaucoma, while we're working on it holistically on this side, we want them to take their drops, because the drops reduces the pressure so that that optic nerve is not clamped off. And so this is one thing I would never want anyone to go blind, and I would never want anyone to say, oh, I'm 100% holistic and I'm not going to do anything else, right? I mean, that is pretty much my perspective most of the time. However, when it comes to glaucoma, which thankfully I do not have, but when it comes to glaucoma, we want to make sure that we take those drops so that that pressure is resolved so we're not going to go blind, okay? Uveitis. So this is an infection in the middle layer of the eye called the uvea. Uveitis can be caused acutely, so not chronically, not long term, but if you get that, it is because there are pathogens or infections in that middle layer of your eye. An autoimmune form of uveitis accompanies autoimmune diseases affecting other organs, and such diseases also have a microbial signature of dysbiosis. So let's just talk about that. What is autoimmune disease? Autoimmune disease is a disease that is really, it's horrible. If you've been diagnosed with that, it's just horrible because your body just doesn't work right. And the reason your body doesn't work right is because it is confused. Your immune system starts attacking your own body because it can't tell the difference between self and outside of self. Your immune system is supposed to focus on outside of self. Remember a while ago, we talked about, we get the cut, right? The soldiers come, the soldiers take care of the bacteria, you get a scab, you get swelling, you get fever, you get all those immune responses, right? But the immune system is going after whatever bacteria got in that cut. That's acute inflammation, and that's okay. The body's working the way it needs to. But when you have an autoimmune disease, your body doesn't know what's going on. Your body doesn't know what is self and what is not self. And so when that happens, the body just attacks everything because it sees everything as an invader. It sees everything as a problem. So when this happens, your diet is extremely important. Your stress levels are extremely important. The doctors will give you prednisone or another steroid that suppresses your immune system, which confuses your immune system even more. So this is a horrible thing to get because there's really nothing out in the medical world that can help you. They just give you steroids to push down the symptoms. However, we do know that with the right gut remake, right, get that dysbiosis resolved, then you can actually unconfuse the immune system. It can take 3 to 6 months. Sometimes it can even take 9 months, depending on what you're doing. But you've got to have the mentality of my health is important, and I need to do the work to regain my health. And so that's changing your lifestyle, changing your eating, changing all the things, which is hard. It is hard for sure. But what is your health worth, okay? And then retinal diseases. Retinal diseases, including inherited disorders, can affect the retina, and it is also caused by dysbiosis in the gut. Now, the retina is located in the back of your eye, and it assists the brain in interpreting the images that it sees. Dysbiosis and inflammation lead to increased intestinal permeability and bacterial translocation, and that plays a role in retinopathies, diseases that affect the central vision. So retinal diseases include age-related macular degeneration. This is where the macula gives fine detail and it deteriorates. You don't want that. Diabetic retinopathy, this involves swelling and leaking of blood inside the eye that can lead to retinal detachment, which they call it diabetic retinopathy because it usually happens to people that are diabetics, but it's not necessarily limited to that. And then some retinal dystrophies that are a group of inherited disorders that cause progressive vision loss secondary to retinal degeneration. Now, I want to show you, we have this wonderful eye vitamin. It's called Occutive. I always spell it with 2 C's, and that's why it never comes up on my paper that I want it to come up. But it's only just 1 C. And I love this because this is a 1-a-day vitamin for your eye. It is advanced ocular health support. My husband was diagnosed with a hole in his retina, and that was not a good thing. And he goes to the eye doctor pretty much every year. And so they said, you've got this hole. Let's see what happens. We'll see you back in 6 months. We said, okay. We got this. We put him on this. And he went back in 6 months and there was nothing to see. And so this is a regenerative vitamin. It doesn't heal you. What it does is it gives your eye the nutrients that it needs to heal itself. And so this is something that we use in our family. We don't have chronic eye issues, but we do it once every 3 to 6 months because it's a good vitamin for the eye, specifically for the eye, and it causes your eye to do what it needs to do. We've also had clients that have diabetic retinopathy, which is the bleeding in the eye. When you have that bleeding in the eye, you've got to get shots in your eye every month. One lady that started taking this, she did not have to go and get shots in her eye for another 6 months. So this is something that really brings health and restoration to your eye, so you might want to think about that. So the loss of the good bacteria in your gut. The April review concluded that an alteration of the gut microbiome leads to an elevated risk of diabetic retinopathy. Published in the Microbial Pathogenesis, it says that features of gut microbiome associated with diabetic retinopathy are the increased levels of harmful microbes that are potentially pathogenic and the decrease of beneficial bacteria, which help offset the bad bugs by maintaining homeostasis. So I want to just talk to you about what homeostasis is. Homeostasis is a medical word that means balance. So we don't really want to have a balance of 50% bad bugs and 50% good bugs. We don't really want that. When we are born vaginally and we are breastfed, which is the way we're supposed to do it, I know not everybody gets to do it that way, but that's the way we're supposed to do it, you have 80% good bacteria, 20% bad bacteria. when we eat food that have antibiotics, when we take antibiotics, all of the bacteria gets squashed. And then if we don't do appropriate interventions, the bad bacteria gets to be 80 or 90%, and the good bacteria gets to be almost minimal. And this is why we have gut dysbiosis. We all eat beef. We all eat chicken. We all have dairy in our diet. We all do. Pretty much all of us. If we don't get organic, we're getting those antibiotics in the meat, in the dairy, and those antibiotics are affecting our gut. And so we have to be really, really on point to make sure that we've got the good bacteria in our gut. The finding in the review noted that patients with diabetic retinopathy had a reduction in the diversity of their microbiome, which can have more than 1,500 different microbial species. Diversity of gut bugs has been associated with better gut and overall health. So modern practices of the way we live has caused the destruction of our microbiome from both the topsoil because of the way we farm and also within our own human microbiome because of the stress, the fluoride, all the things I mentioned earlier, okay? This includes the heavy use of pesticides on the soil, hygiene practices in response to what Kondrat described as germophobia. So we all know those people and there's some famous people, they won't touch your hands, they won't shake your hands because they're germaphobes, right? And I don't want you to have germs. However, when you interact with other people, you're sharing spit, you're sharing air, you're touching, you're doing all the things. And what that does is it goes into your immune system gets on high alert, and it goes, oh, this is harmless, this is something I need to take care of, whatever. And it keeps your immune system strong. When we stay isolated, right? When we stay home, we don't touch, we don't talk, we don't do any of those things, then our immune system actually weakens because it doesn't have that diversity that it needs in order to be strong. So he says we kill our good bugs when we engage in habits such as the overuse of hand sanitizer and the misusing of antibiotics for infections that don't require them. Germophobia also includes the avoidance of contacts with other peoples, animals, and the soil, all of which can be sources of health-boosting microbiome. Now, I'm just going to tell you this because I think it's funny. People come in, and when I do an evaluation with them, I look at their hands, I look at their feet, sometimes I look at their tongue, I do all the things, right? And so they invariably will say, you're going to touch my feet? It's like, yeah, I'm going to touch your feet. And I don't worry about it because I know that whatever's on their feet is going to cause my immune system to rise to the occasion. There's diversity there, and it's going to make my immune system strong. I will just tell you, we had people closer than I am to my device with full-blown you know what, and I never got it because my immune system is very diverse and it is very, very robust. This is because I don't stay home, and this is because I shake hands and I talk to people and I hug people. I play in the dirt with my plants, and we have animals. And so I get all of the challenges that we are supposed to have. So you have to look at what's happening in the gut if you want to get rid or improve your eye health, get rid of the diseases, improve the health. Dysbiosis in the gut is linked to type 2 diabetes, obesity, all right, which continues to affect more and more Americans. As the number of people with diabetes goes up, so do the cases of diabetic retinopathy, which is expected to grow to 130 million people in 2030 and then 161 million people in 2025. It's going to affect 40% of diabetics. That's a lot. That's a lot. So what can you do to protect your eye? You can reduce your screen time. You can play sports, which improves your peripheral vision, and then you need to avoid seed oils in your cooking. So what are seed oils? It's your canola, your corn, your safflower, all of those kind of things you want to avoid. You can use olive oil, you can use avocado oil. You want to avoid all of the seed oils because seed oils are very detrimental to your microbiome. You can also explore things like acupuncture, traditional Chinese medicine, herbal remedies, and homeopathy. So we do here I told you we do this, but we also do this twice a day. Now, this is called Life Pack Nanos. I don't know if you can read that, it's backwards. Life Pack Nanos, and these are guaranteed to be absorbable, and they are guaranteed to have all the nutrition. If you take, it's 12 hours of nutrition. So you take one in the morning, you take one in the evening, and it covers all of the age-related diseases that human beings are exposed to, right? So it helps with your cardiovascular health. It helps with your eye health. It helps with your bone health, your brain health, your DNA. We don't want your DNA corrupted, because when your DNA gets corrupted, guess what? You get things that we don't want to talk about, right? So if you have, excuse me, any kind of sickness and disease in your eye, you want to look at a good vitamin like this, and you want to have a daily multi-mineral, multivitamin that is absorbable. You see that there's a lot of them. You know why there's a lot of them? Because it's not tightly packed together in one little tablet that your body can't metabolize. And so this is why the one-a-days are not good for you, because everything is so compressed and encoded and all those things that it just passes through the system and you get no benefit from it. Yes, there's a lot. This is omegas down here. And I'll tell you, I've had a situation where they got too hot and they started sweating, and I opened the packet and it smelled like fish for sure, right? And then these are all the other nutrients that I need for every day, twice a day. I do it, Steve does it, and we do everything we can to protect our eyes, and I want you to as well. So you can take probiotics. I had a piece of paper. Probiotics, you can do kombucha, you can do sauerkraut, any kind of fermented foods. That gives you the biodiversity that you need. If you take a probiotic, which we do, you want to rotate your brands. And I'm not saying go to the big box store and do all that, but you want to get really good brands. I think we have about 6 different types of probiotics, and you want to rotate those so you get that biodiversity in your microbiome. You also want to make sure that you limit the gluten that you take in, because you don't want to have that leaky gut syndrome. So I know that's a lot, but you guys are smart. You can do what you need to do, and I'm always here for you. Thank you for watching. Thank you for commenting. Thank you for sharing, and I will see you next week. Oh, no, I won't see you next week. It's Happy Thanksgiving. I won't see you next week. I'll see you the week after. Have a great Thanksgiving. Be safe. Be safe.